when I was in med school, I really thought that I was going to do a lot of the research route. And actually, my experiences towards the latter half of med school and at the beginning of the residency is what shifted my focus, which was I was working on a project in developing countries on monitoring sort of pediatric cancer. And I got to a point where my data was interesting, and most people just cared about how I can publish that and write grants about it. Whereas at that time, there was a nonprofit that actually took the data and built a pediatric oncology center with it. And so at that time, it was sort of my decision that, I really wanted to be a person who was building things. And while I do think that medical research, you do get to do a lot of exploration, and it's great, in the end, I really want to have that. I really want to be at the end line where I'm actually building and providing services either to people directly or providing a product that makes a difference to people directly. Yeah, so coming into fellowship, I didn't particularly know what I was getting into myself into initially, but in the end, it's it was sort of create your own type of ordeal or create your own type of curriculum, and I think that pans out perfectly with being an entrepreneur because it teaches you how to be extremely resourceful. And I think the one concept or the one thing that I look for partners now, or I look for anyone I'm going to work with, is that they're resourceful, which is if a problem comes up and it's not even in their domain, that they can figure out either who to contact or how to figure it out in a quick time period without freaking out. And I think that that's a key element that sort of came along with this fellowship, and I think it happens more in this fellowship versus a more standard MBA program or other innovation programs because you're dealing in multiple layers. So you're at the hospital, you're dealing with patients, you're in the AIM lab, you're dealing in conference setup and organization, and then you're over at GSB dealing and trying to figure out how a business model might work. And as you shift those landscapes, you realize that you have to be somewhat of a, you have to become resourceful to be able to navigate each one, and I think that's a particular unique thing about the fellowship. So there's some aspects that are more challenging and some aspects that are less challenging. So from the more challenging standpoint, I do think that coming on as a physician with no background in finance or business markets or design, it's hard to get your space within a community, or if you're trying to do a startup and find your niche, other than specific domain expertise, which realistically you don't need to be full-time to do. Like a physician can provide domain expertise at 2 or 3 hours a week, maybe 1 hour a day, unless it's a clinical startup. So I think part of that is getting the skills to be taken seriously, in terms of essentially understanding the full economic landscape of healthcare, understanding business cycles in healthcare, and knowing that aspect as well as to the domain expertise that you get by practicing medicine.